what are the 3 practical tips for Generation Z or Generation Alpha? So we can start from Dr. Indra.
So in terms of, I think, few steps, important tips. One is prevention. So prevention, I think, is applicable for anybody. If we may be young, old, or in between. So our future health, a lot depends on our behavior in terms of our lifestyle, exercise, diet, and everything, stress. Second is so took care of few things, like for every individual, even a very young age, check of blood pressures, cholesterol, and blood sugar level. This has to be checked. And third, more important is that, as mentioned, if you have some symptom, maybe very mild form, that should not, if it is happening very frequently or more than often, then has to be checked so that we are not missing anything. So early counseling is important if you have some suspicion about future health, and that might happen also in a young individual.
Absolutely. I think that's very important to be completely aware of what you are feeling physically, mentally, everything, and make sure that you reach out for help. Dr. Kar, what as per you are the 3 practical tips for the current generation?
So I think I was going to just make a point that it's important that we stick to simple, frugal lifestyles and believe in delayed gratification. I think that's what is going to be for the youngsters. For the middle-aged, it's going to be to ensure that you're working out more often and that you're eating and having a good lifestyle. Stick back to what we've done. I mean, what we really have been brought up on food that has been commonly available within the house is something that I would generally subscribe to, rather than going out and eating more often. And lastly, as I think prevention is of course better than cure, but at the same time, instead of going for fear mongering, I would definitely say that most people need to be aware of the family histories. So if you have family histories of premature coronary artery disease, you have histories of hypertension, diabetes, you should be more aware. And if you are leading a lifestyle where you know that these kind of diseases are more common, so if you have sedentary lifestyles and you're not getting much of exercise, you need to make sure that you are doing preventive checkups so that you're aware of what's happening to your body. Often that sets off that motion where you're going to get healthy. So sometimes you need that kind of a jump start to ensure or to set you on that path to getting healthy. So which is why preventive health checkups are important, and age is really no bar today.
Absolutely, but a great reminder there for this current generation: go spend time with your dada dadi, nana nani, find out about the family history, get to know if there was somebody who suffered, and if you can, by that knowledge, ensure that you are in safer hands in the coming time. Okay, now Dr. Ankit, what about you? 3 practical tips for the current generation.
So, Ayan and both my colleagues have covered most of it, but if I have to tell 3 things, first thing I would want is your body well. You should know, as Ayan said, you should know your family history, you should know whether you are obese. So assessing yourself regularly is very important. And if you need to take help of a cardiologist or a physician in that, you should take, because you don't know what you are heading towards. And even we don't know. So first thing is that you should know where you stand. What are the kind of risk factors which are possible that can, if your mother and father are diabetic, there is a high probability that you may get diabetes. If they are having heart problems, there is a possibility that you may get a heart problem. If they got a heart problem at 60s, that does not mean you will get a heart problem at 60. You may get it at 30 also. So you should know your body well. Firstly, that. Understanding how there are certain risk factors which can be modified and certain which cannot be modified. Okay, which I earlier said, hereditary pass on of ailment cannot be modified. You can't change your parents. But if you're obese, you can change that. You can change that status. If your cholesterol is high, you can change that. So there are certain modifiable risk factors which you should be aware of, which your physician or cardiologist around you will help you with. And last but not the least, physical and mental health has to be your priority. You cannot, I mentioned earlier this, I may sound repetitive, but I have to say this again, that you have to prioritize health. It's an old motto, health is wealth, and that is still standing as tall as it gets.
What are the top 3 tips for achieving an amazing heart and an amazing life? So, Dr. Ronnie, I would love to start with you. What are your top 3 tips when it comes to amazing heart?
See, I don't think that we have a magic bullet to live a healthy life or to have a heart healthy living. According to me, moderation is the key. Eat moderately, exercise moderately. But if you would ask me 3 tips, I would say probably move every day, eat wisely, and rest well. These would be 3 of my tips in addition to what we discussed to have a heart healthy living.
Thank you, Dr. Ronnie. That sounds like a good, wholesome life. With that, to Dr. Raghu, what are your 3 tips?
The first tip would be know your numbers. Keep your blood pressure less than 120/80, LDL cholesterol less than 70, and HbA1c less than 6. These 3 numbers, every one of us should keep tracking periodically and consistently. That's number 1. The second thing is physical activity, at least 150 minutes per week, or you can go up to 240 minutes a week also. That's the second thing. If you are elderly, if you're walking slow, you can walk longer also. Then the third tip, what I would like to strongly advocate to all the people, is to sleep at least for 8 hours a night, without which I think you will have more and more heart-related events.
And finally, Dr. Arun.
Okay, saving the best for last. No, but like you guys covered a lot of the stuff. So I have to say, I agree with all the tips that have been mentioned thus far. I mean, a couple of other things, all jokes aside. Number 1, learn to manage stress. Like everyone says, oh my God, I have a stressful life. I mean, look, as long as you live and you exist, there's going to be stress. It's our attitude towards it to figure out what are your strategies to manage stress, right? Whether it is, yoga, meditation, whatever, figure it out and actually learn it. It's an acquired skill set. Number 2 is like, don't take yourself too seriously, laugh, have good social connections, learn to chill out with friends, because, number 1, life is too short and unpredictable, but more importantly, this will have a positive bearing on your heart. Now, another disturbing trend that I've noticed is, I did not, we didn't see this many smoking and vaping. So I see that more often now, especially in the Gen Next. I think this is not suboptimal, right, guys? So vaping is not cool. There are other ways to have fun. Stop vaping if you're doing it. And the one other thing, I mean, it's kind of an additional tip, sorry, but please don't ignore symptoms and get a primary doctor, guys. Please don't ignore symptoms. Don't put it off. It's not worth it. If in doubt, just do what you need to do.
What are the 3 important tips in brief that you would suggest for people to have an amazing heart and an amazing life? So Dr. Senthil Kumar, what are your 3 important tips?
Yeah, I'll put it in a very simple way in a mnemonic format so that easy to catch and keep it in your memory. Keep the 90/90 rule in your mind. What do we mean by 90/90? 90 bad cholesterol, LDL should be less than 90, ideally less than 70, easy to remember, less than 90. Your diastolic BP 90, less than 90. 90, your waist circumference should be less than 90. Your fasting sugar less than 100, that is 90. 90/90 to protect your heart. Likewise, ABCD, remember my dear friends. A, avoid alcohol. B, balanced diet. C, cheerful, keep your cholesterol under control for C. Most important C, cigarette cessation. D, dhyanam, divine, and drugs to be taken. There are powers beyond us, God's grace divine. E, exercise. Follow this ABCD and keep your heart healthy, happy, and happy, my dear friends.
Thank you, Dr. Senthil Kumar. And Dr. Srinivas Kumar, what are your 3 tips?
We are telling 5 tips also, not 3. But anyway, be happy and don't get stressed up too much. And if you can practice yoga, meditation, you do it, and take medicines on time. And then probably you should not keep on thinking about what has happened. Be positive, and then probably don't, with the sort of education with Dr. Senthil, Rishi and all, we are struggling to do that. We want our patients to be as normal as possible, and then without indulging into bad habits, and without getting into stress too much. And then probably if you eat, everything in moderation is fine, some sort of exercise, and then some medication taking without changing, without doctor's advice, I think will go a long way in preventing heart attacks. But by and large, what I want to convey to everybody is, if you follow all the preventive measures, you'll decrease the occurrence of heart attacks first. Then if at all if it has happened, also life is not ended there. Still, with all the new medication and rehabilitation programs, you can still likely to lead a near normal life, provided you take care of some basic things what is told. So I think some people become too much cardiac cachexics and bother too much and get depressed. That is, in today's era, it is not required, and they can still lead an as normal life as possible, provided they follow the doctor's advice.
Thank you so much. And with that, to Dr. Rishi Sethi, could you share your 3 tips?
I think the question, Nutan's question, was addressed to me because I specifically have 3 things, irrespective of the fact that whether you have a heart attack or not, you are a patient of cardiac patient or not. If you want to improve your vascular health, and vascular health is the only kind of thing related to the longevity of life. Longevity of life is governed. It is said that you are as old as your arteries. So in order to improve your vascular health, from a point of view of wisdom and from the point of view of science, only 3 things have been proven to have better vascular health, apart from taking care of your medicines and other diseases, diabetes, hypertension. The first one is fasting. Eat less. The second is moderate exercises. Any form of moderate exercise is fine. Pick up any single one sport, gardening, cycling, tennis. Fasting, moderation, moderate exercise, and gratitude. Gratitude in life, a lot of problems that are. And that's one aspect that is missing in most of our lives these days.
Thank you, Doctor, and truly grateful for your suggestions. Thank you, Dr. Parna. Thank you to all of you, because it's been a very enlightening discussion. And I have a final question to all the 3 panelists. That is, what would be your top 3 messages or 3 tips that you would like to give Indian women so that they can have a healthy heart and healthy life? I'll start with Dr. Sarita Rao. Dr. Sarita Rao, what are your 3 messages or 3 tips?
When I talk to women, and I always say that the first thing a woman needs to do is to prioritize herself. She has to know that her health, her heart health today, as we are talking, is very important. Because only if a woman prioritizes herself, if she remains healthy, then the family will remain healthy, the children will get looked after, the elderly parents will get looked after, the husband is going to get to work on time. And I always say, prioritizing a woman's health creates a healthy nation. So the first point is, prioritize a woman's health, prioritize yourself, because you're important. The second thing is know your numbers. What's your cholesterol number? What's your sugar number? And what's your blood pressure number? You need to know that every single year. You need to get it done, because you don't know when it creeps onto you. And these are the risk factors, the basic risk factors for a problem. The third thing I say is that you want to remain fit, and you want to remain fit for a long time, then follow the formula of 80 to grow to 80 without any heart disease. We always say it's very simple, A, B, C, D, E. For a layman, A is for the abdominal girth. Don't put on weight. What's your weight? It has to remain less than 80. B is your blood pressure. Know what your blood pressure is. Try to hit those numbers, which you always be told to keep. C is your cholesterol. Keep your bad cholesterol, your LDL cholesterols at least less than 80. We have a lot more stringent guidelines now. D is your diet. Every time you eat, make sure that the caloric value of your food is less than 80 calories. And D is also for your diabetes. Keep those fasting levels around 80. And E is for your exercise. Make sure you exercise every day. All of us, me, Dr. Sujata, Dr. Aparna, we've been talking about getting that exercise for women, because we always neglect ourselves when it comes to exercise. So at least 30 minutes of exercise daily. You can't do it, you're too busy, at least 80 minutes for a week. So 3 points: prioritize yourself, you're important. know your numbers, and follow this perfect balanced program every day to remain healthy.
Thank you, Dr. Sarita. With that, Dr. Aparna Jaswal, what would be your 3 tips or advice?
I think my first tip will be all 3 what Dr. Sarita said. Second, I think I would like to tell people that it's important that they understand that we must limit the amount of salt that you take. I always make it a point to mention. And they should be well aware that an individual in a daily routine should have less than 1 teaspoon of salt. A teaspoon is 5 grams. I also make a mention about sugar. There is no reason to have any added sugar. There is no reason to have any added sugar in your daily routine. Once a week may be adequate. The thing I really emphasize upon is exercise and weight training. Weight training is something which we don't talk about enough. I am so glad Dr. Sujata spoke about it. Weight training is extremely essential for postmenopausal women for a good bone health. So leaving from what Dr. Sarita said, because I think she laid the foundation very well. The other things is because we don't know how much salt should I take, how much sugar should I take, how much should I exercise, should I do a weight training? These are simple things which need to be reinforced and emphasized every time.
Thank you, Dr. Aparna. And with that, to Dr. Sujata, what are your 3 tips?
So my first tip is again same as Sarita. Prioritize your health. You are the center of the family, and from the family makes the society, and the society makes the nation. Unless a woman prioritizes her heart health, we will not grow as a nation. And the second important tip is, I say, involve the family in diet, in grocery shopping, in making food at home. Please eat at home. Please eat at home. Don't eat processed foods. Eat natural foods and try to make, nowadays with the social media, we can make such good dishes with all the natural foods available. And the third tip is, again, involve the family in an exercise program. All of you exercise together, go for walks together, go for some training together. So all these 3, if you prioritize your health and involve your family in both diet and exercise, you can prevent cardiovascular disease, not only for yourself, for your family, and you're laying a good example for your child.